Uganda has so far registered 2 imported Ebola cases, with 1 patient having died while the other is still receiving treatment. At least 127 contacts of the patient are currently under isolation and monitoring. In neighboring Democratic Republic of Congo, cases continue to rise, with more than 528 suspected cases. On Sunday, the World Health Organization declared the outbreak a public health emergency of international concern, but said it was not a pandemic. But what does this mean?
It means that this disease, first of all, it was in DRC, it has crossed into Uganda, it has potential to become a disease of a pandemic. It's not yet a pandemic, but it has the potential. So when WHO declares, it means there's a lot of concern. This disease could spread. Let us mobilize the resources.
The current outbreak is of the Ebola virus strain. Uganda previously dealt with the same strain more than 15 years ago during an outbreak that ran from August 2007 to early 2008, during which 131 cases were registered. This is now the second time the Bwera strain has been detected in Uganda, and the third outbreak generally involving the strain, considering the current outbreak in DR Congo. Scientists at the time, working together with partners including the Center for Disease Control and Prevention, established that the strain was genetically different from the previously known Ebola Sudan and Ebola Zaire. It was subsequently named Ebola Bwera after the district where it was first identified, in line with naming conventions used at the time.
Many of these viruses are described. They are given the name where they are first detected. Yeah, Ebola Sudan, Ebola Zaire. There was one called Bwera, but didn't spread so much. So this one was first described in the epidemic outbreak that was in Bwera. It does not mean that Bwera now has Ebola, but it's just the name that was given. Like Ebola. Ebola was a village in Zaire, yeah, around the river Ebola. So the name even Ebola comes from some place somewhere.
However, Professor Kalebu says there are ongoing discussions internationally about how viruses are named, following concerns that naming diseases after places can lead to stigma.
For some viruses that were a little bit too stigmatizing, the change was made. There are some viruses where a change was made. For this one of Bwera and the rest, it's also being addressed. Do we really need to continue naming them that way?
According to the Uganda Virus Research Institute, although Ebola Bwera belongs to the Ebola virus family, it differs genetically from the other strains. This means there are currently no vaccines or treatments for this particular strain.
And the way we see these differences is by looking at their sequences, but also when you look at their behaviors, the way they respond to antibodies is different. We have no treatment for this virus, and we have no vaccine.
With the current outbreak, concerns have emerged after Uganda registered 2 cases linked to DR Congo, yet it is viewed in the same picture like that of the DR Congo. Professor Kalebu says because the outbreak has spread across borders, the declaration of a public health emergency of international concern raises questions about how interventions can be strengthened, especially at border points. However, he cautioned against causing unnecessary alarm.
Problems in DRC, when people hear the news and all that, they think we are having similar problems as in Uganda. So far we have had 2 cases. Yeah, DRC has had more than I think 500. So my concern is that let's not be, when people are talking about, let's not be too alarmist that Uganda is the same as in DRC.
Government has since mobilized resources to strengthen laboratory testing. Uganda has also intensified screening at border entry points and has now decentralized testing services with facilities in Arua and Bwera, areas located near the DRC border.
Now samples will no longer be coming to Kampala or Entebbe for testing. When we started these activities many years ago, it would take weeks. It eventually turned to something like a day or 2 days. Right now we are looking at hours. within 6 hours if a sample arrived at a testing lab in Arua. We should be able to give results.
He says one of the biggest challenges remains identifying where the Ebola virus resides. While bats are strongly suspected to be natural hosts, there is still no conclusive proof.
Many people talk about bats, but there is no scientific proof that Ebola hides in bats. There is a suspicion because related viruses like Marburg have been found. And some of those studies were done by our scientists here, working with their colleagues in CDC. They were found in bats, fruit bats, Marburg. But Ebola, we don't know where it hides. So we need to invest in ecological studies to find out where this virus hides. Because you have an outbreak now, then none for some years, suddenly it comes up, so it must be hiding somewhere. We believe that it is really coming from other animals or birds or bats somewhere, but we have no proof.
Ebola symptoms begin with signs that are not very specific, making it possible for cases to initially be mistaken for other illnesses. Health workers are calling for early medical intervention. Some of the symptoms include sudden fever, weakness or fatigue, vomiting, chest pain, and unexplained bleeding, among others. Norbert Atukunda, NTV News.